Hello everyone, my name is Dr. Wayne Collins. We're going to have a little talk today about some stem cells. Now many of you have heard about stem cells and it's the brand new fad or new thing. It's more than that now. It's been approved by the FDA under limited circumstances for use to basically cushion joints and resurface joints. There's various different types of stem cells that are out there. People take stem cells from fat, and basically that's just about to be outlawed by the FDA because the time you put a drug in there and take the fat out and spin the cells down, it's no longer just an intact substance, it's become a substance with a drug, and that drug needs to be controlled by the FDA, so that's just about to stop. And the other one is it's taken by bone marrow. Now typically bone marrow is taken from one location. If the bone marrow aspirates that they put into patients don't work, they'll tell you, gee, the reason it didn't work is you should have had more than one place where they took bone marrow out of it. Now each punch is painful. If you've ever had a bone marrow punch for any reason, you do not want to do that. It's not very comfortable at all. The stem cells we use are called amniotic stem cells. And what they do is that they come from a pregnant woman who has donated her uterus and her amniotic fluid at the time of her scheduled cesarean section. Scheduled cesarean section is because that way the lab can get in there with what's called the sterile white team and they can harvest all the amniotic fluid and harvest that portion of the placenta that's near the mother. We don't want the portion that's attached to the mother. That's where all the anti-rejection things are. So then the tissue bank that we use processes all this and we have stem cells. The cells we use are called amniotic stem cells. Now stem cells do one of two things. They proliferate and they degenerate. Proliferate meaning they divide and multiply, and differentiate means they can change into different cells. Basically, they have the potential to change into anything. They're called mesenchymal cells. They can change into anything where they're placed, where it be damage in a muscle, damage in a joint, this, that. We use it right now mostly for joint damage. It works extremely well. Inside the stem cell preparation, there are anti-inflammatory properties, so if we give them to you, you're not going to need to take your anti-inflammatories anymore. There's anti-sclerotic properties, meaning it dissolves scar tissue. And there's antibacterial properties, meaning that it basically takes care of any kind of infections. In all the hundreds of thousands of amniotic stem cell injections that have happened, there's never been a recorded case of infection from an amniotic stem cell injection. It's a relatively painless procedure. We numb up the area where you're going to get it. We get the cells from a tissue bank. They come shipped to us frozen at 180 degrees below zero. Studies show that they're 94% active, even if being frozen for 2 years. All the studies show that they're still 94% active. So we take that, you hold it in your hand, you thaw out the sample, it thaws in about 10 minutes, and as soon as that's done, we immediately inject it into the patient. You can expect, some people feel changes right away, some in a week or two, but you can expect fairly significant results and changes in movement and function between 4 and 6 weeks. That appears to be the magic time period after a stem cell injection. This works extremely well. It's easy. It's an outpatient procedure. It takes 15 minutes. We inject the joint, we slap a Band-Aid on it, and you walk out. It's an easy way to go. Now the bottom line is this works. If your desire to avoid surgery, avoid a knee replacement, avoid any kind of surgery, partial tear of ligament, something like that, let us know. We may be able to help you. Thank you for your time, and if we can help you, we'll be glad to do it.